Hi, I'm Angela Allen. Through my kids who are both at risk. Their father was diagnosed with HD after they were born, and we didn't know what was in their family and in our family until after they were born, when their paternal grandmother was diagnosed. The need is just so immense and so great. And I think because we're at this juncture where the attention and focus that we put toward fighting HD is just profoundly impactful at this point in time based on where the science is. But the need is so great. I mean, when I look through the experience that we had with my kid's father during the time that he was getting diagnosed and dealing with this disease, we were already divorced when he started having issues with his disease and when we learned of the details of it. And he was on his own, and there were times during the process of his beginning to show symptoms and signs that we struggled to support him without the network that he needed. And that's when I came across HDSA, and where we were able to rely on insights and help to figure out how to apply for benefits that he needed. And knowing that the organization was there and had done the advocacy work that they had done made that process so much easier than it would have been otherwise. And then fast forward a little later, when he needed to have more medical care and support, knowing that we had centers of excellence that we could go to and experts that really knew how to tackle this disease. At one point, he needed to be in institutional living, and we went through challenges of environmental and places where the experience level with HD was very low, and seeing the quality of care he received from an HD specialized facility versus those that weren't was just night and day. And when I look at all those things, from the moment that somebody learns that this is something in their family to all of the stages of early, mid, and late stage dealing with the disease, it's just profound, the need and the opportunity. Now, for me, the focus is on my kids, and they're young, they're teens and early 20s, and the possibility that we could actually cure this disease and eradicate it in their lifetime is just, it's really meaningful, and something that that I don't think every rare disease gets to say. And so, so for us, this is the time to kind of double or triple down on the efforts because of the impact that we can have in the next coming years. Be there for each other, and to put all of our effort forward in supporting families who are dealing with this terrible disease, and focus on research to eradicate this disease so that future generations just don't need to be going through what people are today. But be there for each other.